Hey beauties, and welcome back to Aesthetic Chat with Kiki. I'm your host Kiana Gamble, and I'm so excited to have this next guest on. So I actually met this guest at a training in Atlanta. We both were doing Dr. Doan's training. So I'm so excited to announce Insiyah Darugar as the next guest on the podcast. So enjoy. So first, I just want to start out by having you share your journey into aesthetics and what that looked like.
So I took a bit more of a long and academic road into aesthetics. I really started out in dermatology first. So I've been a dermatology nurse practitioner for 13 plus years. And I began that with a proper fellowship. There's not many of them out there, but there are a handful of dermatology nurse practitioner fellowships in the nation. And I did one at Leahy Clinic, and that is affiliated with the Harvard Medical School Dermatology Residency Program. And that allows for great exposure to a lot of dermatoses that you don't always see. It does have some aesthetics built into their practice and their program, but really that came much later when I joined private practice after my fellowship. So that also led me into to do like a lot of lasers are affiliated with dermatology offices, and that kind of led into injectables, et cetera.
Very cool. And so my question for you, I guess, is with that background in derm, would you recommend people that have a interest in derm to go that way that you went, fellowship and all of those types of things? Or would you had wished that you would have gone straight into aesthetics way back when?
I definitely feel like I'm super grateful for the fellowship program that I did. It's only a small niche of people. They only take 2 people for every 2 years. So to have that like high level medical background, it is invaluable, and I wouldn't trade that for the world. So as far as getting into fellowship programs for derm, they are few and far between. It's up to, maybe the individual if they want to pursue aesthetics as an avenue of one of the many avenues in dermatology. But I think that going into dermatology was super helpful because there's thousands and thousands of diseases. And with that fellowship, you have probably exposure that would take 5 years, and you get it in a much smaller period of time.
Very cool. And so, looking at your practice today, are you still practicing any type of derm?
I do. So I am the owner and founder of Glow Theory Dermatology Studio, and it is essential that I continued dermatology in our office. So that's something that was super passionate. I'm super passionate about skin and all things skincare related. And even when people come in to see me for Botox, I am usually recommending skincare just to help make their skin healthier and kind of further some of their results. But it was really imperative that I continue to practice some level of medicine and kind of help unburden the healthcare systems. Most derm offices have about a 3 to 6 month wait to get in and be seen. And I feel like providing at least even just simple dermatology services, it does help to take a little bit of the burden off the healthcare systems. And not to mention, I really, really enjoy that.
So what made you actually transition out of derm and into more of that cosmetic side of derm?
That's a great question. I think that really the core of it was when you are in a traditional medical dermatology office that takes insurance, you only have that 15 plus minutes to see a client. And I would see 30 to 35 people a day. And it felt like I never got to counsel them as much as I wanted. And it kind of felt like a revolving door, right? And so I wanted a space where I could put the brakes on somebody's appointment, really give them thorough consultation. And even when I have maybe an acne client, let's say, come into my office now, I spend 45 minutes with them. And I think that allows me a full consultation process. And we can really explore other avenues other than just maybe recommending medications to somebody. I might recommend lasers or chemical peels with my esthetician or facials. But we have a lot more to offer than just topical prescriptions or oral prescriptions. So we're very multifaceted in the sense that I feel like we touch base on all medicinal and non-medicinal therapies for acne.
Very cool. So, especially within like the derm side of things, I feel like a lot of times you hear dermatologists recommend, good old Cetaphil or CeraVe, or they go straight to the pharmaceuticals. So, can you touch on the fact that where the potential disconnect or where it comes into the fact that you don't see derms typically recommend, medical grade skincare and maybe the differences between the two?
Yeah. So I will say that being in more of my aesthetic practices, I'll maybe recommend a bit more of those medical grade products like Skin Better Science, for example. Love it. I think when, you're in a more traditional derm office, I still would recommend some of the medical grade products, but I would kind of feel out more of maybe the client's budget. If they're in my chair with insurance, I would probably recommend, use maybe Cetaphil, CeraVe, along with some other prescriptions. But I had no problem previously recommending medical grade skincare. I think it's just that when you're doing, kind of that insurance mindset, sometimes the medical grade skincare doesn't always enter your just as readily as more of an aesthetic practice. So again, in my office, if I'm going to see somebody for even, again, just acne, I love recommending La Roche-Posay is one of my favorite over-the-counter products. I'll still recommend my complexion renewal pads from ZO and maybe facials with my esthetician versus lasers with myself, as well as prescriptions. So here I kind of feel like I mark all those boxes, check all those boxes when it comes to the multifacets. But again, for especially my younger clients, I have no problem recommending a little over the counter as well as medical grade. And I really try to tell them to where they spend their dollars. So a face wash to me is not as critical to spend money on as it is maybe a vitamin C like a Alto antioxidant, which is the best antioxidant on the market.
I 100% agree with you. I love Alto. Put you on the spot a little bit. So when you are talking to a client that is a little bit more budget conscious, what products are you telling them to look for, steer clear for when it comes to buying something over the counter?
Well, as far as like a sunscreen, for example, everybody should walk out of my office with either a sunscreen from our office or recommendations for a sunscreen that's over the counter. I always recommend any of the mineral-based sunscreens. Your zinc should be at least 9+%. Titanium dioxide should be in there as well. And so I really like the mineral sunscreens as opposed to the chemical sunscreens. As far as maybe even an over-the-counter retinol, I might recommend an over-the-counter retinol if somebody has sensitive skin. The La Roche-Posay Adapalene, that's a wonderful product. And I'll tell them, start with that, build up your tolerance, and then come back and get a medical grade skincare product. So I don't feel like those are anything that breaks the bank, obviously. And I think it's a great way to kind of help people pick and choose like where they should spend their money, essentially.
Very nice. Do you have a over-the-counter vitamin C that you recommend? Is it also through the La Roche-Posay?
So that's where I do tell people you're going to want to spend your money on your antioxidant. I would rather them spend their money on an antioxidant than, a sunscreen you can get affordable and over the counter. Even if they needed to, again, start with an over the counter retinol, that's okay with the goal to kind of build up. But where you should spend your money is your antioxidant. Vitamin C, as we know, is a very unstable product, and therefore it needs to have a really good formulation in order to be stable and long lasting. I mean, some of the ones that are over the counter, they might say 10 or 12%. However, what they can't claim is it doesn't last as long as Alto, which has white paper clinical head-to-head trials proving that it is the most potent antioxidant on the market. So that's where the rubber meets the road as far as some of the over-the-counter products. They don't have the clinical trials. So as far as the active ingredients goes, you'll want to make sure that's where you're putting your investment is your vitamin C, your antioxidant, and eventually a retin-A.
Great advice. So currently within your practice, are you managing Accutane patients?
Yeah, I can, but I am cash-based. And so I have no problem, telling families that have come to see me, bringing their teenager or young adult in, really seeking Accutane, has tried every single route. But then I tell them, okay, you might be a candidate for this, but let's break down the price, because the price point is where, not taking insurance, I don't have a ton of Accutane patients, because by the time I add up the price point of their monthly prescriptions, I tell them you can buy insurance for that price.
Mm-hmm.
So I see non-insurance clients. And again, by the time they're purchasing Accutane, they realize, well, boy, that is the price of insurance for the year for my teenager or my young adult. And I think that that's probably a much better route to go, since we are checking labs frequently with that medication.
Gotcha. And so you did mention that, there's a 3 to 6 month wait to see a derm. It's next near impossible to get into even your PCP at this point. So do you see a lot of people regularly? Have you become their, go-to dermatologist to do their annual skin checks and all these things? Are you seeing majority of people choosing to pay out of pocket just to see you?
Yes, I do have a pretty steady group of folks. I have only been open for less than a year and a half, so I haven't really had a lot of those annual visits come back. But I tell people all the time, if you can't get in to see your derm, yes, you can come to see me. Rashes are something that are really difficult to manage. For example, I really have found my niche in the sense that I've had clients seek help for their rashes from their primary care. I had a woman go to her primary care doctor's office, the emergency room, and the urgent care twice. So 4 visits.
Wow.
They misdiagnosed her 4 times. And I said, hey, we're going to take a biopsy, because that's what we do in derm all the time. You're going to pay me to take a biopsy. However, I was able to give her immediate results, and therefore got her on the appropriate medication instead of just chasing this. She should have gone to a derm, but she was still going to be waiting another 2 months to get in with her insurance. So we saved her some time. It was something that is super interesting. She had home dermaplaned,
Mm-hmm.
something I am even guilty of, but with just one of those over-the-counter dermablades. And she had caused a fungal infection on her face, full face, eyelids, upper eyelids, and then later developed a granulomatous dermatitis that nobody in the ER or urgent care was able to appropriately diagnose.
Oh my gosh.
And immediately I knew, this is likely the cause, and we biopsied it. Came back as granulomatous dermatitis, secondary to fungal infection, gave her some topical tacrolimus, and she was cleared up in about 3 weeks, but had the rash for 6 months prior to seeing me.
Oh my goodness. And especially on your face too.
Mm-hmm.
Wow. You are so knowledgeable. Just like listening to you talk, there's so much that you can tell that you have learned, retained, and brought forward into your aesthetic practice now. So that's amazing. I want to come and just shadow you just to watch all the little derm things. But that's amazing. So I do want you to kind of discuss opening your own med spa. You said you've been open for less than a year. So kind of walk me through that journey of deciding to open your own place and kind of just that journey.
Sure. So yeah, we've been open for almost a little bit less than a year and a half. So a little bit more than a year, a little less than a year and a half. But I really wanted a place where it was more of a hybrid office. So not full on derm and not just aesthetics either, because I feel like I definitely have more to offer than just the aesthetics, given my medical background. And so again, I just wanted some place to really marry the two, but not see really advanced cases, because I do think that that's better served in a doctor's office, physician oversight with taking insurance. But when opening Glow Theory Dermatology Studio, we wanted to be able to see all facets of simple dermatology with advanced aesthetics. And lasers, I could not function without lasers because that bioregeneration and health of the skin, there's just nothing quite as elegant as a laser treatment. And so I really personally seen wonderful improvement in people's skin. For example, a lot of my previous pre-cancer and skin cancer patients, it wasn't until we started really lasering them regularly that you could really see their skin health improve. And when they came back to me as medical patients, they would have less precancers. And then fast forward to today, there's some recent articles from Massachusetts General Hospital where I did some rotations at that now can prove white paper studies showing that fractionated lasers help to reduce precancerous lesions and help to reduce basal cell carcinomas.
Oh, wow.
So that was really important that I have those tools. And one of the reasons for that is skin cancer is the number one cancer in America. We have the second highest rate right behind Hawaii in California. And so just about everybody has some level of sun damage down here. And it was really important that I have the tools to help prevent and then treat. So definitely made sure that we had some good, high quality, gold standard lasers, but then just that continued education on injectables, Sculptra injectables, Botox, but love all those bioregenerative type of medicinal properties too.
So what is your favorite laser?
I have the Icon Halo laser and BBL Hero. I just love the two and the ability to treat with both. It's just a really lovely treatment. I have really transformed clients when they are allowing me to do lasers. I love the marriage of lasers as well as injectables because, not only is their skin healthier, but they just looked airbrushed.
Mm-hmm.
And then another thing for my office is I really like being able to put the brakes on people's consultation process. I take a lot of time to do that with folks. And I think that that's really helpful because sometimes I'm going to be biased here. Having worked in derm for so long, I have treated complications of med spas and lasers, right? Correcting some lasers or microneedling mishaps. And I felt like there's probably a better way to perform these treatments. And that is just with a really thorough consultation before ever touching the patient, right treatment, right patient, right? So just making sure the consultation process is extremely thorough is really helpful.
Can you kind of delve into some of the majority complications that you saw from med spas, whether what laser that was or what microneedling device or kind of what you were seeing because of wrong patient selection?
Yeah, I have to say that this is not going to be a popular thing for me to tout on, but something as simple as the microneedling skin pins. I mean, there's no particular brand that I'm zoning in on, but for example, I have repeatedly treated swirl marks on individuals that were treated with microneedling pins. And maybe they were a Fitzpatrick 3 or 4, but it took months for those swirl marks to be eradicated in the skin based on the treatments that I recommended for them. And if I'm seeing that on a Fitzpatrick 4, that's easy to see under a microscope. So we know that we're causing some of these similar injuries, on lighter Fitzpatricks. It's just that that's a much more forgiving skin tone and type to treat. But that's been something that I have completely avoided from my practice is the skin, those microneedling skin pins for that purpose. So that was a common one. Oh gosh, I have treated laser mishaps from, let's just say they're not dermatology offices and they weren't med spas, but other specialties wanting to get into aesthetics, performing treatments, and then we're correcting the hyperpigmentation that has resulted. Now the client has white patches and brown patches. And sometimes that's not reversible. So that's also why I really ensure, correct client, correct treatment, and my consultation process is what it is.
Well, how interesting. Also, how terrible to have, go in for a procedure and then have all these horrible side effects that have happened. But with that being said, especially going back to the microneedling thing, I think the skin pen is actually approved for all Fitzpatrick's, correct?
Healing in general is touted as being safe for all Fitzpatrick's.
But what you're saying is, especially within, your own experiences, is in the higher Fitzpatrick's is where you're really seeing the swirl marks and you're seeing negative consequences.
Mm-hmm. Yes. And I don't want to say, any company specifically, but I think it's something that's moving in and out of the skin very quickly. And we tend to, do circular motions with that. And so that's where I don't want to say it's necessarily a device. It could be the practitioner, obviously it could be even both. I don't know, but I have definitely treated numerous clients from those treatments.
Have you also seen that similar thing with microneedling RF?
No, I haven't, because that device, it's not being moved or dragged on the skin.
Right.
I am really particular, though, when it comes to the handling of devices. So sometimes, I do notice that practitioners' ergonomics are not up to standards. For example, sometimes you see people getting microneedled with RF, but then the device is not flush or flat up against the skin. So here we are, the practitioners delivering the RF on a diagonal.
Mm-hmm.
And so, it's just like anything, you're an injector, so you probably see people perform with poor technique. And we just know that there's just better ways of keeping ourselves safe to deliver good results.
So it sounds like you're a little bit of a laser guru. And anyone who's interested in actually getting into lasers, for me, I know when we chatted like in person, lasers terrify me just because of all of the issues that you can have. So it sounds like to really become someone that's proficient in lasers, they need to dedicate a lot of time.
Yeah, they do. And it's also not just about how to perform the treatment, it's selecting the right client. And then, just like anything, wound management and aftercare. To a degree, just like we get vascular occlusions with injectables, you're bound to see some complications with laser devices. And so it's really about knowing how to manage those. Prevention is key, but how do you manage those when they do happen, and selecting the correct treatment for that client to reverse any undoing that might be done.
Absolutely. And so in your practice, is it just you that's performing injectable services, laser services? Is it mainly you, or do you have a few estheticians?
I have one esthetician and one body sculpting expert in the office, and it is just me performing all the injectables and the lasers. But I am looking to hire. I have a couple of my girls graduating from nursing school, so I feel like they might be the best bet for me in the sense that they understand office culture.
Mm-hmm.
They hear me lecture and educate all the time. When I'm doing treatments, I'm also kind of almost talking out loud as if my assistant is going to be performing this at some point in time. And I tell them, I hold this, I use this filter for this. I drill them. What filter do you think you can burn a patient on the most? So at some point in time, when I have a little bit of extra time to step back, I would like to develop a training course just for like an intro to derm or intro to lasers, because I feel like what I've learned from lasers is amazing. However, there's not somebody to really drill you on knowing all the facets of it. Even when the companies, for example, come in to give you your training, it is maybe 4 to 6 hours at best. And then you're giving the authority to use and operate this machine. And although most people start their career with oversight, there are, practices opening with not as much oversight. And I feel like there's definitely room in the market for this more specific training for skincare and laser management.
I absolutely agree. I think there's a lot of training programs coming out. Everyone's making a training program, but there really are not laser specific, nor are there like a derm 101. So I think that would be amazing. Do you work 6 days a week?
I been working 6 days a week just because I have been thankfully booked out for many weeks, and I'm not going to hire somebody right away, but hopefully in the next few months. But to accommodate my current patients and the new patients, I'm working about 6 days a week pretty consistently these days.
Wow, that's amazing. How has it been transitioning more towards like the business owner aspect? I think that there's a whole lot that is entailed with that. And, having medical training, they don't really cover like a business 101. So how has that been?
So first of all, I have the highest job satisfaction I have had in 20 years of my nursing and nurse practitioner career, but probably the most stress too, right? So there's a lot that goes into opening a practice. I think that anybody that is wanting to do so should think about how much experience they have and how well they manage complications before opening their own practice, because safety first, right? That's always the number one. But as far as the business portion and where I've learned a lot of that, my husband's super business savvy. So if it wasn't for him, there's no way I could have started this business. Luckily, I knew a lot about the medical side of it. But as far as the business side, you kind of learn as you go. We are a startup. I always tell, anybody I hire that, startups all sound great, but in the back end, they're a little chaotic, but it's some learning curves for sure. I have been very fortunate to have built a community of other like newer business owners as well. Of course, there's like some Facebook groups you can get a little bit of help with as well. But really just talking to other people that have done the same thing has been really helpful. My medical director is wonderful. He really is supportive of nurse practitioners, RNs, and has been helpful at getting me the proper connections, and even with training as well. Really good training connections have been made that way. But yeah, I have to give credit where credit's due. And then that's my husband, because he has a degree in accounting and he's my IT guy. He has a degree in accounting. He has a degree in IT and he has a doctorate in public health. So between his multiple degrees and my medical background, we've kind of pieced it together, if you will. I attended some conferences. The AED has the business side of their conferences, and then AmSpa was a little bit helpful as well at being a launching pad for my business.
Very cool. So with kind of circling back to building your team and like building a great culture, previously, did you have experience managing others, or was this a whole new role in building a team, building a culture, and becoming a manager who manages people?
Right. Other than working closely with a medical assistant or two, I didn't really have to manage anybody else other than myself.
Mm-hmm.
I would say that that's a really hard part of being a business owner, is that I love my girls, but I don't try to be their friend. I try to be, their boss and their mentor. So I think that that's kind of important. But all of my staff members, we have interviewed them multiple times before hiring them. So I think it was it Shelby Miller who was on your podcast? I listened to her say, I'm slow to hire, quick to fire. And the slow to hire is something that, I've tried to think about every single question. I ask about their pet peeves. I am very transparent that startups are a little chaotic and that we're growing and we want them to have, something valuable that they can bring to the table, but good energy and good culture for the office is always imperative. Because I have recently let somebody go that just wasn't a good fit for the office and was a little bit like lead in a balloon for the culture. And so, we let that person go, and it's been kind of chaotic filling their shoes, obviously. But, I think in the long run, think about longevity of our business and be protective of it as well. So
I think that those are all great points. And I'm sure that it was not easy to let somebody go. I'm sure that probably was a little gut wrenching, but I think that it sounds like you, even being a startup, it sounds like you have a lot of things working for you well. I do want to ask about the fact that you are in San Diego. How many practices are just within your vicinity, like maybe a mile or two?
21.
And so That's insane. 21 is insane. And you guys are obviously doing well. You are providing great results. If I lived in San Diego, I'd want to come and work for you. But kind of talk about how you have either set yourself apart or how you have gone about, becoming one of the big fish in a vicinity that has 21 med spas.
So yeah, that 21 is just a mile and a half from us. I have somebody that just opened a very large practice, just opened actually within my plaza. But I think the difference is, gosh, we're seeing a trend of investment group buying at practices and then not having a whole lot of high level training go in there. Or investment group type of med spas tend to be kind of burn and churn. So they are not the owner providing care. They're not some, I take a lot of pride and I go a lot of extra distances to ensure all of my clients are taken care of. Am I perfect? No. Am I working to make my office and my practice better? Yes. I find that there could be little business mistakes here and there, but I will tell you, I am somebody that really strives to not make the same mistake twice. And growth and learning are something that is very important to me. So with a lot of other competing offices, I guess you could call them competition, but I feel like we are going to the beat of our own drum. We have more of our hybrid model, and a lot of my clients, they actually tell me that they seek me out because they have pre-cancers and skin cancers, and they know that even though they're coming in for Botox, I'll point out if they have something. And so I'm taking a little bit of that extra time to kind of care and manage. Another part of our business is social media. And as Dr. Doan mentions, it's just a visual business, right? So we want to always ensure too that people can have kind of a look-see of our office on, even if it is just Instagram, because we post educational and motivational before and afters and journeys on there. So
that's amazing. I think that I really like your perspective. You can tell in your voice that you have a passion for what you're doing as well as a passion for your patients. I think that the big companies that are coming in and opening med spas or buying out med spas, it's, I think, very apparent that they've never stepped foot in a med spa, nor have they ever provided care in that manner, to where they're definitely missing big key factors. Like, I trained with a woman this last month and their clinic was overtaken by a big company and they were cutting all appointment times down to like 15 minutes. Botox and filler. Like, I don't even understand how someone could safely do a filler procedure in 15 minutes.
No, that's right. My new patient Botox appointments are 45 minutes, but I'm always sneaking skincare in there. They need to be on the trio of sunscreen, antioxidant, retin-A. Every dermatologist should tell them the same thing. And so for me, that is just critical that they get that piece of information. And if you really think about it too, business-wise, all of your clients should be purchasing skincare from your office, even if it's just one thing.
Mm-hmm. So kind of my last question for you is, what trainings have you been to that you felt were super valuable?
Well, I would say that my initial fellowship at the Leahy Clinic Dermatology residency program was instrumental. I got to see a lot of dermatoses that physicians don't get to see. I worked in a leprosy clinic, by the way, there, and not too many residents these days, dermatology, even get to rotate through things like that. So that was so unique. I don't think that I will ever be able to put a value on that enough. A couple of people that have been really instrumental for me is Nicole Lowry, PA Nicole Lowry. Her teaching style and her understanding of anatomy has been great. Chris Urich's anatomy cadaver class is what I'm going to be going to next. That's what I can't wait for. And then Dr. Tui Doan, I just loved her business sense along with her injectable vision and her consultation process. I think that how I do derm consultations, now that kind of changed a little bit after I saw her, I realized that I just need to make sure that I'm hitting all of my pathology marks when I'm doing consultations for derm. And so I think that just helped me fine tune that. I was almost there and now I am there. But Dr. Tuidone was a really helpful one that you and I met at. So that was wonderful.
Yes, that training honestly was so much more than I had ever expected. We'll have like a little like NDA approved discussion on that training course. But yeah, have you felt, since you've come back from that training, have you implemented a large sum of what you've learned there, or have you taken just snippets?
No, her consultation process for any of the injectors out there, it's just a lot more thorough than what I guess we have always been taught. And so when somebody comes in asking for some of those a la carte treatments, I've always already have told clients, well, I can't have your lips walk into the room before you do. Maybe I don't say it like that, but obviously take the opportunity to show them they might have deficits or areas that might be better for their correction if they're seeking that. But now I almost exclusively do like full face consultations, even if they are asking for a particular area, because that is, a long-term plan down the line. And this is somebody you want to have in your practice forever. And I think that kind of helps put the patient at ease too, that one, you know what you're doing, and that two, that they know in their mind what to watch for if they feel like, I see a little something of this and that. She already told me, Insiyah told me that if I see this, come back to the office. She already knows what the plan is.
Perfect. Do you think you'll head back to the training within the next few years to do a refresher, or do you feel like you got everything you could out of that training?
I think that I would go back for sure. It's so hard to sign up with her. I think that's the hard part. So yeah, I would love to go back and see her maybe after another year or so. And then next on my radar is Leslie Fletcher. I think that she's just amazing. And I've attended some of her online lectures, but I'd like to go see her next as well. So there's a few other people that I'd like to see a little bit. And then, I'll kind of keep circling around, like some of the big fish until I feel like maybe I've learned enough to start teaching on my own.
Very cool. So any last things you'd like to leave, any pearls of wisdom that you'd like to leave with my listeners today?
I think the most important thing is just ensuring that, there's your client's skin health is just as important as, maybe their filler or some of their aesthetics. It's part of their aesthetic goal. And talking about sun health and skin health is super important. And that there's nothing that quite touches the elegance of a laser.
I love it. So where can the listeners find your page, your practice, all of those types of things?
Yeah. So we're pretty present on Instagram at My Glow Theory is our Instagram handle. And if somebody wanted to email us, it is info@myglowtheory.
Perfect. Well, thank you so much, Insiyah, for coming on the podcast today. Thank you, Insiyah, for coming on Aesthetic Chat with Kiki. You're so knowledgeable, and I'm just so happy that everything's working out for you down in San Diego, and I'm just so happy that we met at that training with Dr. Doan. So, you know where to find the podcast Instagram by now, I'd hope. It's at aesthetic.chatwithkiki. My Instagram is at aestheticnurse.kiki. The website is aestheticnursekiki.com, and you can find us on YouTube, Apple Podcasts, Spotify. Until next time, beauties. Bye.